a full show for you this morning, so we are going to start right off with your good health. If you struggle with everyday tasks due to rheumatic disease, you'll be interested to know that there is a new study out that reveals that many Americans could be living healthier and more fulfilled lives. We are joined by Dr. Christopher McCauley from Johns Hopkins School of Medicine, an expert in this field. Good morning, Dr. McCauley. It's really interesting that an estimated 54 million Americans live with rheumatic disease. Can you explain what's considered a rheumatic disease and what might be the most common ones?
Yes, and good morning to you. So rheumatic diseases include inflammatory, autoimmune, and degenerative conditions. And they commonly affect the joints, the muscles, but any organ can be involved. There are actually over 100 different rheumatic diseases that exist. Some of the more common ones people may have heard of include osteoarthritis, lupus, and gout, but there are many others that are more rare. Things such as rheumatoid arthritis, scleroderma, myositis, and the list goes on. And as you said, they're quite common in aggregate.
Dr. McCauley, can you tell us about the National Patient Survey and what you learned?
Yes, so we learned three things regarding access to care, how affordable it is, and how patients are coping with these diseases on a day-to-day basis. So from an access standpoint, it turns out that 60% of patients need to wait at least a month before getting in to see a rheumatologist. So there's a big delay of care, and that speaks to the national shortage of rheumatologists that we have. And some patients need to wait even more time, 2, 3, or 4 months to get into the office. So that's an issue that needs to be addressed. The other issue regarding access is the access to medications. Some patients have constraints about which medications they can be prescribed, something called step therapy, which is a practice that insurance companies do, where they basically will not cover a certain medication until patients have failed other medications that they prefer, even though me as the doctor might not be very enthusiastic about those other medications. So about half of patients experience this process known as step therapy. Affordability was the second issue that we kind of noted in the survey. About 60% of patients have difficulty affording their medications and treatments. And these are patients, by the way, that already have insurance, so they have substantial out-of-pocket expenses. About a quarter of the patients said over $1,000 a year is required just to afford their medications and treatments. So that's the second issue. And the third and final one pertains to lifestyle, how patients are dealing with these diseases on a day-to-day basis. And that's perhaps the most sobering statistic. 2/3 of patients report that even simple tasks are quite difficult due to their rheumatic disease. We're talking about just getting out of bed, starting your day, cooking, cleaning, basic hygiene, all things that are difficult for these patients.
Doctor, if they're getting the medications, are there good treatments? Are these good therapies for them? Are they effective?
Yes, so I'm very happy to say that yes, they are. We are getting better every day with generating more medications and new treatment strategies for these diseases. We've come a long way already in the past couple decades, but there's going to be a lot more improvement, I anticipate, in the upcoming years.
That's good to know. Dr. McCauley, how can we get involved and how can our viewers learn more?
Sure. So really what we need to do is act on a policy level. So the American College of Rheumatology is sponsoring legislation, both at the state level and the federal level, to really tackle some of these issues, increasing the number of rheumatologists so we can better match supply and demand, limiting practices like step therapy, making medications more affordable. But patients and caregivers can get involved as well. They can go online, they can write letters to their representatives about these issues, because it's always good that our representatives hear from multiple people and multiple stakeholders. And they can do that at a website, www.simpletasks.org. There's a lot more information about this there, and they'll have access to some sample letters that they can go ahead and customize and send to their respective representatives.
Thanks, Dr. McCauley. That's quite enlightening. And with so many, 54 million Americans suffering from those diseases, I'm sure there's a lot of people outside listening and will be doing their part to get better treated. Thank you so much. We appreciate you being with us today. And again, that was brought to us by the American College of Rheumatology.